underlying conditions and their connection to COVID-19. My name is Laura Holloway, and I'm the Director of Communications at Sharp Chula Vista Medical Center. If you'll give me just a moment, I'll pull up our presentation and we'll get started. Okay. It's our tradition at Sharp Healthcare to begin every gathering with a reflection. And so our reflection for this afternoon is, it is health that is real wealth and not pieces of gold and silver. That was by Mahatma Gandhi. And I hope that you'll leave this webinar this afternoon with some wealth, and that will be the knowledge that you get from our wonderful physician presenters that we have here with us today. So I'll give you a quick introduction to our two featured speakers, and then we'll go into their two presentations. And I think you'll really enjoy hearing what they have to say. Both of them have been working on the front lines of COVID-19 throughout this pandemic, and their specialties make them uniquely positioned to understand the underlying conditions that millions of people are living with and put them at unique risk for this virus. And so I think you'll really enjoy hearing from them. At the end, we'll open it up for Q&A, and I would really encourage you to ask any question that you have. Our experts have graciously agreed to share their time and expertise with us this afternoon, and I know that they'd be happy to answer your questions. So any questions that you have, you can feel free to put those in the Q&A box. You can put them in there anytime throughout the presentation, and we'll answer them at the end. Our speakers this afternoon, again, we are so fortunate to have two experts in their fields. We have Dr. Marilyn S. Norton. She's a hematologist oncologist. Her practice is South County Hematology Oncology here on the Sharp Chula Vista campus. And she also serves as our Chief of Staff at Sharp Chula Vista Medical Center. Dr. Stephen Ruff is an interventional cardiologist at Heart and Wellness Center, also located in the South Bay. And he's the director of our Cardiac Advisory Committee. With that, I will turn it over to Dr. Marilyn S. Norton. Please go ahead, Dr. Norton.
Thank you so much, Laura. Next slide. So first of all, wanted to thank you all for joining us this afternoon. We hope that this is a very educational hour and a half that you'll be spending with us on learning about COVID-19. I was born and raised here in National City / Chula Vista. I went into the military. They paid for medical school, and I did my internal medicine residency and fellowship in hematology oncology. I had the pleasure to serving during Operation Desert Storm and Operation Iraqi Freedom. I was fortunate in 2000 to find a job in Chula Vista and work with Sharp Chula Vista. So I've been at Sharp Chula Vista working here, servicing the community for 20 years now. One of the things that I like most about working in Chula Vista is, number one, being at home. Number two, running into patients that were either elementary school teachers or classmates from elementary school and high school. So it really has been an honor to be able to settle down and work in Chula Vista and to take care of our community. Next slide. So COVID-19, coronavirus 2019. We know that the coronavirus is from the family of viruses. For the most part, coronavirus 2019 or COVID-19 causes respiratory infections like the common flu. Why is it called COVID-19? So the virus was first discovered in December of 2019, and that's why the 19 refers to the year that it was discovered. We know that with COVID-19, some people can get much sicker than other people. Who are those patients that tend to get worse infections when they get, or worse illnesses when they get COVID-19? Usually it's our older population, our older adults, and also people with underlying medical conditions. Next slide. So coronavirus 2019 was officially called a pandemic in March of 2020 by the World Health Organization. We were 7 months going into our 8th month of this pandemic, and it has devastated the entire world. Globally, COVID 19 has infected 38 million people. We've had over a million deaths, with the mortality rate of those 38 million people being 2.8%. In the United States, we've had 7 million cases of patients infected, with 217 deaths. And as we all can see in the news, this continues to climb. Nationwide in the United States, we have a 2.7% mortality rate. The mortality rate being a little bit lower in California and lower in San Diego, only being at 1.6%. But we still had 844 deaths reported as of the end of September and 51,000 cases. Next slide. So, what are the symptoms of COVID 19? For the most part, it's like the routine flu or the annual flu that we can get. We can have fevers, 101, 102. Many patients will get a cough. We do notice that there is significant amount of fatigue that comes with this illness. In some patients, the fatigue can last even up to months after getting COVID 19 or after recovering from your respiratory symptoms. You can continue for months later to have fatigue. One thing that seems to be unique about this virus, the coronavirus, is the loss of taste or smell. That doesn't happen in everybody, but that is a very common complaint that patients will have. Shortness of breath and trouble breathing comes with the respiratory symptoms that we get, with the coughing that we get. Muscle aches and pains, that's very common for the regular influenza virus, influenza A, that we see. But we also notice that the muscle pain that we get with COVID 19 tends to be much more intense. Sore throat, chills that comes with fevers, and headache. So as you see, almost all of the symptoms that we get are about the same as any influenza virus or any other virus. But we know that with COVID 19, the symptoms tend to be more intense. Next slide. So the patients that have chronic health conditions, we know that those are the patients in our community that are at much higher risk for becoming seriously ill. Because we know that most patients that get the virus, that get diagnosed as having COVID 19, most of them will not be admitted into the hospital. But the patients that are seriously ill or have chronic underlying medical conditions are the ones that are going to be at much higher risk for being admitted and at much higher risk for death. Dr. Ruff will talk a little bit about our heart patients with heart failure, with heart disease, coronary artery disease. As far as cancer, we know that cancer is going to suppress your immune system. You know that if you have cancer, you might be undergoing chemotherapy. You might be on a different type of treatment that's going to suppress your immune system, or even having stage 4 cancer where you're living with your cancer and we're trying to extend your life. We know that those patients have a suppressed immune system and have a suppressed capacity to be able to fight an infection. And those are patients that are going to be at higher risk. Chronic obstructive pulmonary disease, that's a lung infection that we get from smoking, whether it be smoking in the remote past or an active smoker. So underlying lung conditions puts us at increased risk. Diabetes, adult onset diabetes, especially if the diabetes is not being well controlled, your immune system is not going to be up to par to be able to fight a virus, and a virus like COVID 19, which could be devastating. Obesity also suppresses your immune system if you're not eating healthy, if you're overweight. Chronic kidney disease, or patients that are on dialysis. Our patients on dialysis, they get infections easier. They will very frequently need to get admitted for their infections, and a weakened immune system. So Patients that have, let's say, rheumatoid arthritis or have an autoimmune disorder and they have to take medications in order to control their autoimmune disorder, those patients have a suppressed immune system and they also can be the ones that are at higher risk for COVID-19 to be more of a devastating or an illness that they die from compared to the general population. Next slide. So blood type. There's been a lot of research done since March, April, May, when we first started seeing the cases of coronavirus. Most of our studies that started were Danish studies, but we do have now studies out from Italy and from Spain, and some Canadian studies that notice that patients that are type O have a lower risk of getting COVID infection and have also a lower risk of having severe outcomes. Now, the way these studies were done is they took the population of a certain city and they studied what is the rate of infection, for one, of COVID-19 compared to the general population, and what is the population of patients that have type O, patients that are type A, type B, and type AB. And then they saw the patients they looked at the patients that got COVID-19 and the patients that were infected. And they noticed that type O was definitely lower percentage of getting COVID-19 compared to the percentage of type O that we had in the community. Same thing with their infections were not as severe. Now, we don't really know what is it about type O blood that will put patients at a lower risk. It is just something that has been noticed in the scientific community. One thing that I think that I did not stress last week during our webinar is that there's plenty of concern from the medical community to make sure that our community knows that just because you have type O blood doesn't mean that you're going to be at less risk. Doesn't mean that you need to let your guard down. Doesn't mean that it's okay that you're the one that's going to go to the grocery store because you have type O and, I'm not going to worry so much about wearing my mask. You still get COVID-19. We just know that it's at a lower percentage than patients that might be type A or type AB. So the bottom line regarding blood typing is that everybody should be aware that they're at risk and everybody should do strict hand washing and wearing masks at all times when we're outdoors or when we're indoors and not in our own home. Next slide. So cancer and COVID-19. We know that patients that have cancer, as I mentioned earlier, have medical conditions that puts them at increased risk for getting COVID-19. And patients that have cancer are twice as likely to become infected. Patients that have cancer are also 3 times likely to die from COVID-19. We also know that patients with certain types of cancers, if you have blood-related cancers like leukemia or lymphoma, that resides and sometimes begins in the bone marrow, where our immune system is living at, or is the bone marrow is a big part of your immune system. When that is suppressed, we're going to be at increased risk from dying from COVID-19 and at increased risk from getting COVID-19. There are multiple organizations, American Cancer Society, American Society of Clinical Oncology, that's tracking patients with cancer and tracking patients that are getting infected with COVID-19 to get an idea of what the outcomes are and also the experiences with our patients with cancer. I like to say at this point that as an oncologist, I've been very proud to be able to work at Sharp because even though we were in the middle of a pandemic, March, April, May, and continue to be in this pandemic, Sharp has always taken a priority for our cancer patients because there are certain things like maybe you could put off your mammogram for a month, or you could maybe put off your colonoscopy for a month. but we don't like putting off chemotherapy for a month. We don't like putting off our scans that are going to be checking to see how your chemotherapy is working. And Sharp made it a priority for our cancer patients to be able to continue. So even though we had to downsize significantly because of how many patients we had admitted into the hospital and the manpower that it was taken to take care of the COVID-19 patients, there was that commitment of patients that had cancer, that had ongoing that had ongoing treatment. We were able to continue that and not delay. Next slide. So how do you avoid COVID-19 if you have cancer? We know that we're going to be asking our cancer patients to be much more diligent, but still to continue what the CDC guidelines are. We need to avoid exposure as much as we can. We stay home whenever we can. Definitely try to avoid places where there's a large gathering of people or where people tend to gather. We need to wash hands frequently. And when we do wash hands, wash for a good 20 seconds with soap and water. When we're not able to use soap and water and wash hands, using a hand sanitizer. And we know there's many hand sanitizers that are out there, but those that have 60% alcohol or higher are going to be your more effective hand sanitizers. Avoid at all costs touching your eyes, touching your nose, touching your mouth. Sometimes we forget when we have a mask on and we want to go take a drink or we want to take a bite of something, we take off our mask and we forget that when we take off our mask that we touch our mouth and face, and that's something that you need to try to avoid doing until you're able to do a very good hand washing. Avoid people that are sick. I tell all my patients when they ask me who could I be around, I tell them that when you're at home, please tell family members don't come visit if you're ill. I don't care if you're wearing a mask or you're wearing gloves. If you're ill, don't come and visit me. I'll see you when you're feeling better. Clean frequently touched objects and surfaces, and we sometimes forget that we need to clean off our phone. You know, we'll go out about our day and our phones will be touching things. The phone that just went off. We'll be touching things, and we don't stop and think when we take off our mask that that phone has probably been on many surfaces. And so before you put it up to your face, wipe off your phone. Uh, and the last one on there, wearing a mask. And when we wear our mask, make sure you cover your mouth and your nose. We very frequently find ourselves sometimes having our mask just covering our mouth, but leaving our nose exposed. Next slide. So preventing cancer, very important during this pandemic to remember to not put your health at risk, not stop doing the prevention and the screenings that we need to do. When we do screenings, when we do vaccines, when we eat healthy, we're making the right choices and doing our part in trying to prevent cancer. The cancer screening of having your GYN exams and having your pap smears. Pap smears are now recommended to be done every 3 years if you're human papillomavirus negative and have the same partner. We previously used to recommend having pap smears done annually, but we don't need to do that if your human papillomavirus test of the cervix comes back negative and you have the same partner. Having vaccinations for human papillomavirus between the ages of 9 and 26. If you don't have the human papillomavirus yet, we recommend that you be vaccinated. It's a series of 3 vaccines. Same thing with hepatitis B. Maintaining a healthy weight by eating right and exercising, so being physically active, and obviously avoiding any types of tobacco, whether it be chewed tobacco, smoked tobacco, doing the pen, including trying to avoid secondhand smoke as best as you can. Protecting your skin. I know the summer's almost over, but in San Diego, we still have a lot of UV, a lot of sun when we go outdoors, making sure you use sunblock to protect your skin. Also limiting the amount of alcohol that you drink. We know that alcohol is a lot of empty calories and not calories that are necessarily good for you. So drinking alcohol in moderation and really limiting the amount that you drink. Getting tested for hepatitis C. We know that there's a lot of damage that could occur to your liver and cancers that could occur to your liver, and making sure you get tested for hepatitis C so that you can be treated for this is another way of preventing cancer. Contact your doctor if you find a new lump, if you find a new mass, if you notice something different. We know that our primary care physicians are available via telemedicine. If you're too afraid to come out of the home or would rather not come out of the home, please contact your physician. And most of the physicians, primary care doctors, are able to do telemedicine to be able to talk to you about your symptoms or what you've noticed, and to see what testing needs to be done to try to catch something early if it's occurring. Next slide. So there are many resources that are out there, resources about cancer, resources about preventing cancer, and resources regarding COVID-19. If you go to our Sharp Healthcare website, sharp.com/cancer, is going to have a significant amount of information for you to be able to access and call if you'd like. American Cancer Society, their website is cancer.org, where you're able to get information regarding current prevention, information about different cancers, and also information about COVID-19 and during this pandemic, how we can help our cancer patients. Centers of Disease Control and Prevention, cdc.gov, has a vast of information about prevention and treatment, and what do we need to do regarding regarding COVID-19 and what preventions we need to take. And also, having said that, don't forget that it's flu season. We can still get influenza A. And so we are, as physicians, a little bit concerned about what's going to happen this coming winter, because we're going to be battling both COVID-19 and influenza A. So please make sure to get your influenza vaccine. Cancer Control Planet is another website where you can get information regarding cancer, and also includes a section on with the current pandemic and COVID-19. And thank you so much. I'll be available at the end so that Dr. Ruff and I can answer questions for you.
Thank you so much, Dr. Norton, for that great information. And I know we've already got a few questions for you that we'll get to shortly. Now it's my pleasure to introduce Dr. Stephen Ruff.
Thank you, Laura, and thank you, Dr. Norton, for all that very important information. Definitely on a lot of the things that you touched on is very helpful and meaningful, and definitely something that's affecting everybody in the world. And any little bit of information that we have is definitely something that can help modify and deal with this very difficult period of time. So I'd like to thank everybody for the opportunity to be here. I definitely enjoy practicing here in the South Bay. I did take a little bit of a circuitous route. I started off being born in Chula Vista, moving on past elementary, ended up in junior high in the Valley, and then moving on to Arizona for high school, and then also Northern Arizona University, where I majored in microbiology and minored in chemistry. So I never thought that that would play into my interventional cardiology training, but I guess we'll go into some detail on how that interplay is happening as we speak. So moving from Northern Arizona, did end up going to medical school at Temple University in Philadelphia, and then moving back to the Midwest in St. Louis University for general cardiology, and then back to Philadelphia for interventional cardiology. So came back to Chula Vista because I wanted to bring that training to a population here in the South Bay where my family members are, and decided that this would be a great place to see if I could open up and start up a practice. And it seems like so far we're doing okay, and definitely enjoyed helping the South Bay. It's been definitely a rewarding experience, so I thank you all for that opportunity. So moving on to the matter at hand, which is the management of the other underlying conditions with that increase our COVID risk. And I think Dr. Norton did allude a little bit on some of the factors We look at obesity as one of those all-encompassing risk factor. When our body is carrying that extra weight, or even when you're overweight, our heart is working extra hard. We're carrying that extra weight around with us wherever we go, and it's surrounding all of our body. So even if we're sleeping, we have that extra weight on our chest when we're trying to breathe. If we're walking, carrying that extra backpack of if it was weights or rocks or that sort of thing. And so whenever we're carrying extra weight, our heart tends to work harder. Our body's working harder. There's more demand. It's more taxing on our body. So that's why some of the factors that we do consider this to be one of them is because of that weight and how much it causes our body to work even harder. In the same interplay as when we talk about smoking, if we currently smoke, it definitely causes our body to be in a state of inflammation. Nicotine itself is a vasoconstrictor, and when the body causes or when nicotine has been exposing the body, so when the body's exposed to nicotine, you have vasoconstriction, and when that happens, then there's inflammation that occurs. It's almost like a strangulation, and there's impairment of the immune system when that happens. COPD along with smoking, again, their interplay is just when we look at all these different risk factors, I think of cardiovascular disease, and I can't really, sometimes I take a double take because I'm wondering, wow, a lot of these factors that I'm seeing for cardiovascular disease are also going to be increasing your COVID risk. And there's an interplay with the immune system and cardiovascular disease that we're constantly seeing. Heart failure, cardiomyopathies, when the heart is weak, there's less reserve, so our body's not able to pump, or our heart's not able to pump blood throughout the body for that increased demand. So if we have that underlying condition of a weak heart and we're attempting to exert ourselves just as a baseline, we're asking more from the heart than it can provide. Now, if we're exposed to COVID, what's going to end up happening is that our reserve is a lot less. And that's why it's important to protect ourselves and how to manage it in this current environment if we do have the underlying heart failure. So taking medications and keeping up with your exercise is definitely an important thing. This plays into that. So any stress on the body, we're asking our body to give us more. Sometimes it's just not enough that our body's going to be able to give as much as it can, but sometimes that's not enough. And then type 2 diabetes, Dr. Norton did allude to having type 2 diabetes is another risk factor. We know that there's impaired wound healing. We see that with our patients. If the diabetes is not under control, we see that the wounds they will not heal very well. There's also increased complications from pneumonias and infections, influenza. So very important to get your flu shot. And also to take your medications to make sure that diabetes is under control. And it's not only medications, it's also the exercise factor. And then also the dietary factor, which I'll go into in a little bit. Next slide. So let's talk about obesity in detail here. Adults with excessive weight are even in greater risk during the COVID-19 pandemic. Their increases in risk for severe illness is because of that increased weight and how much more we're taxing the body carrying around that extra weight. They have a triple risk of hospitalization, and also there is a link to impaired immune function. There's decrease in lung capacity and reserve because they're not able to take a deep enough breath because of the increased abdominal contents due to the increased reserves there. And then also as BMI goes up and your height-weight ratio, then the risk of COVID-19 increases is some of the information that we've been learning over the past few months. And some studies have also shown that obesity may be linked to lower vaccine responses in numerous diseases. So even if we get the vaccine, we're looking and we're hoping, everybody's crossing their fingers that the sooner the better. They're thinking that maybe in the middle of 2021 that we're going to be able to get widespread vaccination. And even then, if you have these underlying conditions, your immune response when you receive the vaccine is not going to be as robust. So these are some of the factors that we definitely need to help modify whenever we're in that category. So it's definitely something that is has an interplay with the immune system. Next slide. Diabetes. We do not have enough data to show that whether people with diabetes are more likely to get COVID, but we do know if they do get it, they do have worse outcomes in general from diabetes. People with diabetes have much higher rates of serious complications and death in general. So by de facto, if you apply that into somebody who's had even the flu, you can see that this will have a worse outcome, such as death or other complications. When we talk about viral infections and diabetes, this can definitely increase inflammation. The immune system is trying to fight off this invader, and this causes blood sugars to be out of control. You're in a stress state, and the insulin doses may have to go up, and you're noticing that you're not able to control your diabetes. Is when a couple of weeks before you were exposed to the virus, they were under control. And also with the risk is likely to be lower if diabetes is well managed. So again, very important to control that diabetes and the blood sugar levels, and therefore allowing the blood sugar to be under control and your immune system to respond to this infection and the viral illness. Next slide. Blood pressure. Uncontrolled or untreated high blood pressure can lead to severe illness. We know this. And I have had patients tell me, well, doctor, I feel fine, I feel great, but you're telling me my blood pressure is high. Yes, that is the case. It's one of those silent symptoms. We don't feel anything, but we take the number, or we take the blood pressure and we see the numbers elevated. And when we see that, this is definitely a risk factor that's contributing to worse outcomes, whether it's stroke, albeit heart attacks, peripheral vascular disease. We see all these interplay between this high elevated blood pressure. So with patients whose blood pressure is controlled, they seem to have a lower risk of severe complications. But what are some of the lifestyle changes and medications that are key in this scenario when you're looking if you have a diagnosis of high blood pressure? One of the things you can do is definitely have a heart-healthy diet. And what are those? I'd like to definitely reference Mediterranean diet, which I can go into a little bit in detail later. One of the factors that you do have to take into consideration is definitely limit your salt intake. What happens is where salt goes, water will follow, and it takes about 2 to 3 days for your kidneys to get rid of that salt. So if meal behind meal behind meal, you're having extra salt intake, it's going to increase the fluid content and your overall hemodynamics, which is what we called the way that the heart and the blood vessels interact, is overall going to be elevated. And so you're going to find yourself in a higher category with increased blood volume, higher blood pressure, and all that high blood pressure will end up hurting the kidneys and putting you at risk for risk of stroke and also for heart attacks. What are some of the other things that play into this? Is losing weight. I've had patients who are on multiple medications for high blood pressure, and they end up losing weight by exercise and dieting, and then we're scaling back the medications. And you should see the response, and it gives me a lot of pleasure because being able to tell them, look, if you follow this certain modifications to your lifestyle, you're going to find that your blood pressure will start to come down, and we're going to have to scale back those medications. So when I say that, that also acts as a motivator. And similarly with diet comes activity. So the calorie intake that you're having, you have to use that fuel. So walking regularly, that's one of the definite recommendations that we give. In the American Heart Association, as a minimum 20 to 30 minutes a day, 5 days a week. And if you do more, great. But it has to be a continuous 20, 30 minutes. I've had, can you do it 5 minutes here, 10 minutes there? No, it has to be a 20 to 30 minute period of time that is continuous. And looking at other factors, avoiding and limiting the alcohol intake and avoiding smoking or quit smoking for sure, avoiding secondhand smoke. We talked about some of the potential benefits of alcohol. There is some studies that suggest red wine is having some factors or qualities that help decrease risk of having cardiovascular events, but does that mean we have to start drinking wine? No, it means that be careful if we are currently consuming not to do that in excess, and that doesn't mean everybody has to start drinking wine. But in the pandemic, there was an uptick in people consuming alcohol, so we definitely have to keep that in check and modify that and be careful not to overindulge. And moderation is definitely helpful. So smoking, definitely another factor in elevated blood pressure, like I alluded to earlier. Nicotine itself is a vasoconstrictor. So that interplay I was talking about where the heart is pumping and then the blood vessels are the resistance pushing back against the heart. So if there's more resistance and the blood vessels are constricted, then the heart's going to have to work harder to push that blood forward. And nicotine causing that vasoconstriction, even if it's in the vaping, will cause this effect in the body. So you're going to have an overall elevation in your blood pressure. Next slide, please. Blood clots. So I asked to have this put in because over the past few months, we have noticed an increased risk of having blood clots form. And since in cardiovascular disease, as an interventional cardiologist, being on call at the hospital for ST elevation myocardial infarction, this is that type of heart attack where somebody comes in gut-wrenching chest pain and clutching their chest, having that emergency heart attack where the blood vessel is 100% clotted off, or we have to emergently go inside and try and open it up, is definitely another interplay between inflammation, clotting, and cardiovascular disease. And so not only in the heart, but we're also seeing it in the brain. And then that also with having COVID-19, we've seen patients have clotting within their legs or in the veins of the legs, and that can break off and travel to the lung, causing a pulmonary embolism. That's almost insult to injury because right now, let's say, forbid you have COVID-19, your oxygen levels are already compromised. So if your body's under this attack with the virus, having inflammation, and then you have a clot on top of the low oxygen levels that travels to the lung, it's going to decrease the capacity of the lungs to work, that putting that person at risk for even worse outcomes. So as a result, we've noticed that, and so there's been some different treatments over the past several months to be able to modify that and decrease that risk when we do detect that. So we're more aware in this situation and scenario. There have been reports of increases in severe strokes, even in young patients. So you think, okay, well, I'm 20, 30 years old, I'm in that lower risk category, I'm fine. I get COVID, it's a little bit of the sniffles, and I'm doing fine. But, there have been those cases, very tragic. I think there was somebody in their 20s, I'm not going to go into much detail, but unfortunately, they had complete cardiovascular collapse. And so you never know. You never know who it's going to strike. There is some good news in the horizon, albeit that we do have the capacity. There was a study that was published where they looked at NYU and their healthcare system, and their mortality for their hospitalized patients with COVID originally was in April and March and April was around 25%. So if you ended up in the hospital around that time, a 25% chance of not passing away. Now, fortunately, as time went by, we learned more about different clinical scenario with this clinical scenario and how to treat it better. And advent of medications, which you may have heard of dexamethasone and utilizing that to calm the inflammation, and then oxygenation, which is key, has decreased that down to about 7.6%. And that's reassuring, but we have to have the capacity, right? We have to have the available hospital beds. That doesn't mean we should go out and put caution to the wind and throw caution to the wind. It means that, okay, we've gotten a little bit of a handle of an understanding of how to treat this. And so at least now we have a little bit of an improvement in our situation, but we still have to have that capacity. So if we're starting to become overwhelmed in a healthcare setting and our hospital beds fill up and we don't have the resources, that's when that number can change again. We'll start having an increase in that mortality. Next slide, please. All right, so what do? We're afraid to go out of the house. We can't interact with anybody. Even going to the stores seems like a huge ordeal. We have to prepare, to put our face masks on, wash our hands before and after touching anything. We carry our little hand sanitizer and we spray our hands every time we touch something. And how do we stay healthy in that kind of environment? I've had, unfortunately, yes, a lot of people have taken a few steps back and not being physically active. But we've noticed I've had patients tell me, well, yeah, I've fallen off the wagon, this COVID thing. I understand, this is not easy, but we do have to find creative ways how we can modify our behavior and maintain that physical activity. So I was alluding to earlier about the 20 to 30 minutes a day, 5 days a week of that regular exercise. And it's something just to get your heart rate up. Now, that could mean just standing in place. So if you start to walk in place, that could be a good activity. Anything to get that heart rate up, or walking around. It seems pretty boring, but the perimeter of your home, or if you have a wide open space park where you can actively socially distance, that would be another option for you. And yeah, staying active is the key part to that. The other part is then, the intake of and the quality of food. When somebody asks me, well, what kind of diet, how should I eat? I'd like to say, well, follow the Mediterranean diet. So, well, what is that? Well, you're looking at increasing your fruit and vegetable content. You're going to think more of seafood and like fish and chicken as your protein, and sometimes some of the different variety of beans that have high protein content, such as chickpeas. And then you're going to substitute butter and unhealthy fats for olive oil. So the extra virgin olive oil has increased omega-3, and that ends up being a healthy fat for the body, even the heart. There have been studies where they compare patients who are taking statins, which is your regular medication you take for high cholesterol, to those who are on the Mediterranean diet, and they did about the same, which is good news. And so it says to me that if you do modify your diet, your overall risk of cardiovascular events, strokes, heart attacks, are lower. Now, that's something that can change over time. And obviously, we've all been eating a certain way for many decades. And so I ask my patients, just make slow changes, make a few changes here and there. Maybe cut out soda. I've had patients stop drinking soda and they drop 10 pounds for no reason. And that's one easy way to quick jump start to that change. So the other part is being sedentary. So keeping a close eye on how much time you're spending on the couch watching reruns of Netflix or a whole 5 seasons of, Game of Thrones, if you will. Be careful with that. The inactivity is definitely going to take its toll. So schedule some time to definitely move around. It's just 30 minutes out of the 24-hour day. So we can find some time for that. And then ultimately, there was a talk that was given earlier about your mental health. We're human beings. We definitely crave that human interaction. So this is definitely a very difficult time. And so even if it's as little as picking up the phone and talking to somebody, just know that there are resources out there that are available. We have the advent of what we're seeing right now, which is technology that where we can see each other. So that helps. But is it the same 100%? No. But for right now, this is what we have. And it's going to change. We're going to have improvements on this technology. And hopefully, with the advent of the vaccine, we'll be able to continue and improve on that. But wear your masks and continue to socially distance and wash your hands. All right, so very important here is one last message, well, 2 last messages. One is continue to take your medications. I know there was some information early on where the coronavirus receptor of where the coronavirus was attaching was part of the ACE2 receptor in the body, and patients have been on medications that treat blood pressure that are working on a similar system. And so with that, we didn't know exactly whether or not we should continue or stop those medications, but it looks like we definitely should continue the medications to control the blood pressure and chronically. Other than that, we're here in the hospital. We definitely continue to take care of our patients, and unfortunately, there have been times where patients delay their care. I've had a patient wait as long as 3 weeks to come in, and unfortunately, they had had a heart attack. And for that individual, that part of the heart was not working anymore. So it's scarred over. It already become complete scar. So it was, even after improving the blood flow because of the blockage from the heart attack, it did not improve the function of the heart. So they were in the new category of systolic heart failure and cardiomyopathy. So now they're moving into an even higher risk category if they do fall with COVID-19. Now, the other part is I also had a patient who had a heart attack and they waited 3 days. Fortunately, we were able to catch it. We improved the blood flow. They came back in 4 weeks later with a rupture in that heart, and that heart had to be sewn together with open heart surgery. So that outcome was something that we had seen 20, 30 years ago. That's not something we should be seeing today. We have the technology, we have the availability, the hospital is there, and we have the staff, we have the nursing staff everywhere from the front door of the emergency department all the way till the cath lab, and then recovery, and then going home. So if you feel symptoms that are concerning, chest pain, the shortness of breath, the swelling in the legs, passing out, those are things to definitely be evaluated in the emergency department. So I'd like to say thank you for this opportunity. Please be safe, stay positive, and I hope you test negative. Thank you.
Thank you so much, Dr. Ruff, and thank you again, Dr. Norton. Thank you for these important messages you shared on this slide, especially, both Dr. Norton and Dr. Ruff touched on the importance of not delaying the care that you need. We're 7 months going on 8 months into this pandemic, and from the beginning, Sharp and all healthcare facilities, our partners at Scripps and UCSD, everybody in the medical profession is taking this pandemic really seriously, but also taking very seriously the care that we know needs to continue. So we do know that some patients are fearful of coming to the hospital. It's no secret that we do have patients in our hospital who do have the coronavirus. We're treating them for the coronavirus, but we've taken many steps to keep everybody safe. We separate those patients. In the emergency room, we keep them separate. And then in the hospital for patients who are admitted, we have ways to keep those patients separate so that they don't infect others. There's a lot more that our teams have worked really hard and continue to work really hard to do to make our hospitals and clinics and doctors' offices safe. And so if you're interested in finding out a detail about those things, you can go to sharp.com/getcare. The other thing I want to mention, I should have put this on the screen. I'd be happy to put it in the chat. Dr. Ruff mentioned the emergency room, and that you definitely should not delay going to the emergency room if you're having an emergency like a heart attack. We recently opened up the option to schedule a reservation in the emergency room. Now, I will say that would not be for something life-threatening like a heart attack, but for something a little lesser like abdominal pain, something like that. If you would like to avoid the time that you spend waiting in the emergency room, you can go to sharp.com/ChulaVistaER and you can make a reservation and be given a time to come into the emergency room. And so that way, if you do have to wait a little bit, you can do your waiting at home. So just to reiterate what Dr. Norton and Dr. Ruff have said, please don't be fearful of coming to any hospital or any clinic to get the care that you need. We're going to open up with Q&A in just a moment. Just want to make a note here. When you click to leave the webinar, it should pop up with a survey. We'd really appreciate your feedback. These webinars are new. We have always held education for our community. It's something that we're really proud to do, but like everybody, transitioning to a virtual environment is new for us. So we thank you for going on this learning experience with us and hope that we've done a good job. But please help us take a survey to let us know, good or bad, any feedback, and also if there's anything that you would be interested in learning about going forward, because we hope to continue this education. This webinar is being recorded, and Dr. Ruff mentioned that we have held 2 other webinars. One was on mental health and coping, and the other one was about caring for older adults. As Dr. Norton mentioned, older adults are also at significantly increased risk of the coronavirus, and so some great content there. Those videos will soon be available on sharp.com/COVID webinar videos. Just give us a couple of days to get those uploaded, but then you can go there and have access to those and share them with your friends and family. And finally, if you need help finding a doctor, Dr. Norton was mentioning primary care physicians, and a lot of them are offering virtual visits and other conveniences. If you need help finding a doctor, we'd be happy to help you choose a Sharp doctor, and you can do that by going online to sharp.com or calling 1-800-82-SHARP. You can find the doctor who speaks your language or is in your community, or if you want a male or a female, whatever you're looking for in a physician, we can help you out with that. The webinars, like I mentioned, mental health and coping, caring for older adults, and then the one that we've had here today. We have held all of these webinars in English and Spanish. And so if you know anybody who would be interested in learning this information in Spanish, please share it with them. Those will all be available on the website that I mentioned. And with that, we'll open up for Q&A. And so I hope there will be some questions. There was great information shared with the physicians. We did get a few questions that came in privately to me during the webinar and also beforehand. I'll also keep an eye on the Q&A. I've got it to the left of my screen. If you see me looking over, that's what I'm doing. So feel free to put your questions in the Q&A and we'll get to those. Let's see, the first question looks like a good one for Dr. Ruff, talking about obesity. Is there still an increased risk for coronavirus if you're overweight, or is it just if you're obese?
Yeah, so I think it's more of a gradual factor. You look at how much away from your ideal BMI, you're going to find yourself a slowly incremental risk. So when we look at obesity as a risk factor, we see that hand in hand, sometimes we do see diabetes come together with that. We also see hypertension develop. And as we see as the grade or the change over time, or the amount of distance you are from your ideal BMI, then that risk would probably start to go up. So could I say exactly where I could refer you to exact documents? Of course, we're still learning a lot from the coronavirus and the research studies. It's one of the factors that we do see. Yeah, so I would say it's more of a gradual. So how close you are definitely determine that.
Thank you, Dr. Ruff. We've got a question here. What vitamins are appropriate to take? I know you both touched on kind of diet and lifestyle. Dr. Norton, anything you want to say about what vitamins are good to take?
Yeah, I mean, I think that eating a healthy diet is what's most important. I mean, there's a lot of patients, and there's some data that maybe, taking one multivitamin a day, especially if you're over 50. But I think instead of concentrating on how much vitamin C or how much vitamin D, now Dr. Ruff will talk about cardiac and vitamins, but I think from the oncology community that I have, it's mainly eating a healthy diet.
Yeah, so with no, it's a good response, and I definitely agree that looking at the quality of food, that the intake of food is definitely important. And I know one of the factors that does contribute to heart disease is vitamin D levels. So it's considered to be in that category. So if you have a low vitamin D level, yeah, definitely something that could be helpful. But if you're taking a multivitamin or you're adequately supplementing your intake, it should be enough to keep you out of that category, but definitely something that could be checked by your primary care. And if you're in any of these increased risk factors, then we could test that level and see if you need supplementation. Sort of like a loading dose, boost, and then after that, maintenance, and then repeating that blood level. So.
Thank you both. Dr. Ruff, another question for you. What about type 1 diabetes?
Yes, in general, as far as a risk factor for.
Yeah, I think they mean.
So, yeah.
Yeah.
So yeah, no, I definitely falling into that category of having adequate glucose control. It does fluctuate. So in the period of stress, any time that the body's exposed to an infection, there's going to be lack of control of glucose. The normal body response is for the glucose to go up, and accordingly, our pancreas produces insulin to mitigate that. And so we're finding that, it could potentially provide some sort of risk in patients who do contract COVID-19. So continuing your routine, making sure lifestyle falls into that category. So forbid that you do fall in and contract COVID-19, that you do have that reserve in place and don't delay your care.
Thank you. Our next question, I'll leave it open for either one of you who would like to answer it. It says, at one point, there was a concern about taking ibuprofen if you have COVID symptoms. Is that still the case?
Well, Steve, I might leave that to you. I can't say that I've heard of ibuprofen or an NSAID making you more vulnerable to COVID-19 or making the disease worse.
Yeah, there was a little bit of noise. When I say noise, I mean data, background data that suggested that maybe there was a link, and that was early on in March or April. And if it was, I don't know if it was France, there was somewhere where they started to remove the ibuprofen because of that association. And so it's hard to so I guess the more important thing to look at is when you have all this information coming at you and it's a new virus, so we haven't been exposed to it, is trying to tease out all this data. And this is one of those things. So we hear all this information, we're starting to, over time, learn, and then we decide, okay, is this a real signal of the data that's coming up that means something? Or is it something that maybe was slightly associated because, all right, we have patients who are sick. What do you do when you get sick? Well, I have a fever. I'm going to reach for my usual medication, which is Aleve, Advil, ibuprofen, Motrin, what have you. And so there was association there. Does that mean it was directly causal? Hard to say. We all know that if you take too much ibuprofen, that can harm your kidneys. That's one thing we do know. And then also, there's also been some noise or signals in the data, even in cardiovascular events, that we've noticed that perhaps those who take ibuprofen, Motrin, those shorter acting NSAIDs, that there may be a slight uptick in cardiovascular events. Again, hard to pin down. When you get more data, then you start to see these slight signals of information. So nothing strong. So I would say it's not something that's a significant or a major no-no. Yeah.
Thank you. Another treatment medication that's been in the news. So Dr. Ruff, perhaps you might want to continue. What is known about Regeneron, the medication that President Trump received?
It's not readily available. I think that's something that was an emergency use basis, and I don't think it's 100% proven yet. It's still under investigation, so we need to see a little bit more information on that. And the antibodies, Regeneron is basically a cocktail of antibodies that have been identified. Antibodies are those things that your immune system will develop, which will attach to things that don't belong there. So it's sort of like flagging these foreign items that shouldn't be there. And your immune system will recognize them and start to go after those things and attack them. So these antibodies perhaps heighten the immune system and said, wait a minute, what's going on here? These are all new antibodies that have identified a potential invader. And so it's hard to tell. So that's what they do. That's how it works. But do we know exactly what are the long-term outcomes? Is it safe? Is it too much of an inflammatory response? Is it attacking the right receptors? Are we getting cross-reactivity or crosstalk receptor on our kidney, and then it's attacking our kidney? So it's hard to say. So we only have a little bit of information regarding that. but it was used in an emergency response type setting. And so, yeah, that's what we know in general.
Thank you. Next question is going back to the blood type slide, it looks like. Is there anything that people with those higher risk blood types should do differently, Dr. Norton?
No, I think that just like if you have type O, you shouldn't bring down your guard. No matter what type of blood that you have, I think we have to have our guards up at all times. The wearing of masks, the strict hand washing, and not go into large groups. We're coming into the holidays. It's going to be tough to not get together with family, but if the family's got extended family, and before you know it, especially here in the South Bay, it's going to be 80 or 90 people in a gathering. And so I think that there's nothing different that you need to do. You just need to be aware that you might be at less risk for type O, but you shouldn't be taking any less precautions or any more precautions because you're AB. It should be standard across the board, the same precautions.
Thank you. Dr. Norton, maybe another question for you. Are children with conditions like cancer and asthma at increased risk of COVID?
So I know that Dr. Ruff educated on this last week, in the sense that we know at first when the first pandemic hit, we weren't sure if children were carriers or if children were exposed to, and now we know that even though they might have the majority of the children might have just a light viral illness, we do know that there is now a syndrome in children that can be pretty devastating and affect their various organs. And so, yes, children can get COVID-19 also. Dr. Ruff, I don't know if you want to say more on that.
Yeah, no, exactly what you're saying. There was I think it was some multi-system inflammatory syndrome or something to that effect in children, where the immune system just goes rampant and affects every organ in the body, hence the multi-system inflammation. And so the virus is, again, unpredictable. We don't know how it's going to affect. And what are the factors why does it affect certain children? And why does this happen in certain children? We don't know. I'm sure there's definitely people out there investigating this, but it's a sad thing to see. And so if we're doing everything we can, then we can feel like, okay, we did everything we can to help avoid this. And just, fortunately, it was one of those things that happened. And now that we learned a little bit more about it, things like dexamethasone that helps calm the inflammation, it might be something that may help in that scenario. But yeah, no, there was a study that looked at patients who ended up in the hospital. So they looked from some symptoms or going to the intensive care unit, being intubated on a ventilator. And out of the 100 patients and varying degrees of infection, more than 70 of them had some sort of heart inflammation. So even though you're largely minimally symptomatic, there is some indication that it's affecting different parts of the body. Now, is that a direct inflammation to the heart muscle? The studies were done looking with the heart with an MRI. That's a very sensitive way to check to see if there's inflammation. Now, if it's direct effect or just a side effect, it's hard to say, but yeah, that's what we're seeing. Still learning more about it.
Thank you. Kind of in a similar vein for either of you, are there any promising studies being done right now? Anything new and upcoming?
I mean, I think there's definitely ongoing studies. I mean, even just on the antibody cocktail that Dr. Ruff was talking about, it's not FDA approved right now, but there are ongoing studies of having this antibody cocktail for patients that are positive with COVID-19 in a trial setting. Same thing with plasma from COVID-19 patients, where we've harvested their plasma and we're infusing plasma. So there are plenty of studies that are ongoing. Just within SHARP, I think there's 3 active trials for our COVID-19 patients. So there are many ongoing trials.
Anything you'd like to add, Dr. Ruff?
No, yeah, no, it's actually a worldwide response when you think about it, how it is that this is something that thousands of scientists are working on, and it's just definitely something out there is going to start to hit, and maybe we'll get lucky. We'll be looking at something else. I know there are some biotech companies here in San Diego looking at using just every available drug. They pour it into a vat, and then they analyze it and basically trying to see which ones are what combinations are effective to help us figure out and how to understand potential treatments in the future. So anything from antibodies to vaccines to and medications we already have, those are some of the things that we're looking at. And so we're trying to attack this, and there's thousands of people working on this, if not hundreds of thousands, and hopefully we'll get a break. But yeah, so keep our fingers crossed.
Thank you for that. Thank goodness for the researchers, right? Dr. Ruff, another question for you. Is there any data that the higher your blood pressure is, the worse COVID gets?
That's a good question, because I know when I was looking into a little bit into the medications that factored into those who are infected with COVID-19 and the ACE inhibitors, the ARBs, and back early on when we were trying to decide, should we recommend patients stop it, continue, that sort of thing, they did notice that the lower the blood pressure was after the infection, if you're in intensive care unit, the worse outcomes there were. Now, we talked about inflammation, we talked about increased blood pressure. As a normal response in the body, the blood pressure will rise whenever it's under stress. We see that very frequently. For whatever reason, fevers will make your blood pressure rise. The heart works harder, it's pumping faster. Now, if your baseline blood pressure is already elevated and you add that little extra, that's definitely going to make things worse, whether it's from a stroke, the hemorrhagic kind, or your heart working harder and causing micro tears in the heart blood vessels, which then lead to heart attacks. Those are some of the things that all play into having worse outcomes. Like I was alluding to earlier, when I looked at all these different risk factors and how to manage COVID-19, I'm seeing patients that have heart disease. I see diabetes, high blood pressure, cholesterol. So it's astounding just that immunocompromised or immune system play with the cardiovascular system. And we know that nicotine causes vasoconstriction, leads to inflammation in the blood vessel walls. So if you're smoking and then you have insult to injury with the vasoconstriction and more of the inflammation with the infection, then worse outcomes are bound to happen.
Thank you, Dr. Ruff. That concludes all the questions that we received. Let me just make sure I didn't miss any. I did just put in the chat the link that I mentioned. If anybody does need to come to our emergency room for a non-life-threatening condition and you want to save your spot rather than waiting in our emergency room, you can go to sharp.com/ChulaVistaER. I want to again thank our experts for all the great information and education today. Thank you so much, Dr. Marilyn S. Norton and Dr. Stephen Ruff, for the time you gave. And I want to thank all of you watching at home or at work, wherever you are. Thank you for investing this time in your health. Thank you for wearing your mask and practicing hand hygiene. And we hope that you will take this information and pass it on. Thank you again. We hope you have a wonderful rest of your day. Bye.
Thank you. Bye-bye.
Thank you. Bye-bye.